Thank you so much for those listening here today. My name is Christina Sire. I'm the Executive Director for the Iowa Chapter AAP, and we are fortunate enough today to have the wonderful speaker, Franck, join us with the Des Moines Waterworks team. She is a microbiologist and will help educate us on how we keep our waterways clean in the Des Moines metro area and all of the pieces that go along with that as well. I'm going to go ahead and hand things over to Katie. We have a lot of information to go through today. I'll be monitoring the chat, so if you do have questions throughout the presentation, either virtually raise your hand or come off of mute or drop it in the chat, and I will ensure we have all of our questions answered today. That's all that I have for my piece, so Katie, feel free to take it from here.
All right. Well, thanks for joining me today, guys. So I'm going to jump right in and get started here. So this is an article that was published in the American Medical Association's Journal of Ethics, and it highlighted the important role that medical professionals play in helping their patients understand water quality and how it affects their health. And so the main reason that I am here today is to help you develop an understanding of water quality so you can play this role as well. So our objectives today are to increase knowledge of water quality in Iowa, to increase knowledge of drinking water regulation, water treatment, and water distribution management, to increase knowledge of recreational water regulation and management, to identify health risks associated with poor water quality, and to increase knowledge about the role of medical professionals in public health education outside of the clinical setting. So to start off, I wanted to give you a little background on water quality in our freshwater sources. So these maps show the various regional and local watersheds in Iowa. And the main takeaway from this slide is that you can see that the regional watersheds can be quite large for some areas. And this allows for a higher potential of contamination in source waters that drinking water utilities use, especially if they're using surface water. Some of the main contaminants that we see here in Iowa are nitrogen, phosphorus, and bacteria, which includes E. coli. So where is all this contamination coming from? So Iowa watersheds contain large amounts of row crops, and much of this cropland is also utilizing tile drainage. So if you look at the graphic in the bottom left corner, you can see all the tile drainage in the state. Obviously, it's concentrated there in that Des Moines lobe, so any utilities that are using water from those watersheds are going to see high nitrate, which includes us here at Des Moines Waterworks. Now, normally nitrogen will follow that nitrogen cycle that's up in the upper left corner of the screen. And over time, nitrate would be broken down into other forms of nitrogen by bacteria. However, the tile drainage basically short circuits that whole cycle. And then the nitrate is very water soluble and will just follow the water wherever it goes, which is usually into our source waters. There are also many confined animal feeding operations in the watersheds. So you can see that on the other map on the right side of the screen. And this contributes to additional contamination through nutrient and manure runoff. And all of this contamination combined will pose health risks to humans and animals and contribute to overall poor water quality in our fresh waters and source waters. So how do drinking water utilities protect the public? So we follow the Safe Drinking Water Act, and people are often surprised to learn that the drinking water is regulated and how much regulation is in place. So federal regulation of drinking water dates back as far as 1914, and the Safe Drinking Water Act was passed in 1974 by Congress. It has been updated and amended a few times to include additional regulatory requirements for new contaminants and to add source water assessments and protection. It is our primary federal law that ensures the quality and safety of drinking water, and under this law, over 100 contaminants are regulated. All water systems are required to test for these contaminants and ensure they are meeting the drinking water standards. The drinking water standards were established using human health studies and scientific research, and they did include those sensitive populations such as the immunocompromised, pregnant individuals, children, and elderly when they were making those standards. So the standards should be protective of all of those groups as well. Any laboratory that performs the testing is required to send all of the results to our regulators, which at the state level is the Iowa Department of Natural Resources, and at the federal level is the US EPA. Now, depending on where you are in the state, your drinking water utility may use different treatment methods to treat the water. Basically, every water treatment system is going to have multiple treatment steps. And this is an example of some of those steps. So this is our Floor Drive water treatment plant here at Des Moines Waterworks. It's a conventional lime softening plant. And I'm just going to very briefly kind of walk you through what happens. So initially, the source water is going to come into our treatment plant, and it will go into these pre-sedimentation basins, which take out some small particulate matter, taste and odor compounds, things like that. And then it's going to go into a lime softening basin, and the lime softening basins will help remove hard minerals and will also help remove some microorganisms and other contaminants. The water will then go into our filter building, and sand filters will act as another physical removal of microorganisms and contaminants. We do adjust the pH in the softening basins as well to make sure that the water is non-corrosive. Now, we're kind of unique here at this plant because we have this nitrate removal facility, and there's actually a picture of it up here in the right-hand corner. Those are our vessels, and they use ion exchange to remove nitrate. So if we see high nitrate in our source waters, we will send the water to that nitrate removal facility. If we don't, we'll bypass that facility, and the water will go into the clear well. And that is where we're going to add chlorine for additional disinfection to kill off any residual microorganisms or anything that might still be there. And we do also add fluoride as well. Now, every water treatment utility also, so they do their water treatment, whatever that looks like, and then they're also required to test and monitor the distribution. So when I say distribution, that's all of that underground water infrastructure that carries the water from the plants to the homes and businesses. And so we will check for that there's no microbial growth in the system, that we have adequate disinfection residuals, and that we have adequate corrosion control in our distribution system. If there is also any kind of like main break or cut, so you've probably seen videos of water main breaks and the water's like shooting out of the road, like up into the air. So it looks really messy. And sometimes, if they are really messy and they meet certain conditions, boil advisories or bottled water advisories will be issued. And that does not mean that there's something wrong with the water. That is just a precaution. So if you do have a boil advisory, if your patients have questions about that, there's nothing that we necessarily found wrong with the water. We're just using that as a precaution in case something did happen and was able to get into the system. We also will do testing on any kind of water tower maintenance, and any person who wants to hook up to any drinking water utility, so whether that's like construction workers or contractors, they have to notify the utility, and there is regulatory guidance, which I have up on my screen, through the Iowa DNR for laying those new water mains as well. So all of the results from all of this testing are available publicly. So the Safe Drinking Water Act emphasizes that consumers have a right to know what is in their drinking water, where it comes from, and how it's treated. So you can find those results on your drinking water utilities consumer confidence report. So we have ours available on our website, and there's a lot of utilities that have it up on their website as well. If you want to check for utilities throughout the state, you can actually go to the Iowa DNR's drinking water portal page, and you can look up every single drinking water utility in the state, and you can find any compliance sampling that was done. You can see where it was done, what the analytes tested for were, and what the results of those tests were as well. So those are a really nice resource if you want to see what your water utility is doing and where they tested. So now I'm going to talk about fluoride because we get a lot of questions about fluoride. And the US EPA has an enforceable drinking water standard of 4 milligrams per liter, and this was established to protect against skeletal fluorosis. Then there's also a secondary non-enforceable standard of 2 milligrams per liter, which was established to protect against tooth discoloration and pitting in children. So even though it's not enforceable, if any drinking water utility exceeds that 2 level, they do have to notify their customers with a public notice. Now, the US Public Health Service recommended an optimal level of 0.7 milligrams per liter, and their research suggested that this concentration will maximize oral health benefits while minimizing any potential risks. And the CDC also supports this level. So most drinking water utilities that I've seen target this 0.7 range. So over here is one of our water quality reports, and you can see all 3 of our plants. We kind of aim for that 0.7 range. This is pulled from Iowa City's CCR, and they kind of hit that same. They're at 0.68, so right around that 0.7 range. So that's where most utilities are hitting. Drinking fluoridated water does help keep teeth strong and reduces cavities by about 25% in children and adults. So now we're going to talk about some specific contaminants, and we're going to start with lead. So this might come up with your patients, especially if they have young children, because as we know, lead poisoning in children can cause severe nervous system damage and developmental delays. So the treating drinking water itself will not contain lead. The lead has to leach off of the pipe and the plumbing inside of whatever building that you're testing from. And this is a concern in older homes that might have lead service lines, fixtures, or solder. So under that Safe Drinking Water Act that I mentioned earlier, it does require that drinking water utilities have some sort of corrosion control treatment of the water, and it's to prevent this corrosion. Now, I do want to say if you have patients that have a home water treatment system and it has a water softener, it's imperative that they properly operate and maintain that system, because if they over soften their water at home, they can actually make it corrosive, and then that can lead to problems. So I just like to put that out there for people. And I can't talk about lead without mentioning Flint, Michigan. And this is also a really nice example of how a medical professional helped her community and really pushed and advocated for the drinking water quality to be improved. So basically, what happened in Flint was in April of 2014, the Michigan governor, Rick Snyder, appointed an emergency manager and wanted some cost saving measures done. So, one of these cost saving moves was to change the source of the city's drinking water from the Detroit system to the Flint River. And they made this switch without really understanding the water chemistry of that new source. So, the Flint River is highly corrosive. And Flint's infrastructure is very old, and over half of the city's service lines were made of lead. And in another cost saving move, city officials did not implement adequate corrosion control, which led to the water crisis. So, in addition to the lead that was happening, iron was leaching off of the pipes and reacting with that residual chlorine that we like to keep out in our system for added disinfection. And this allowed bacteria to grow because the chlorine was getting eaten up by that iron. So, in response, the city tried to add more chlorine, which led to the formation of disinfection byproducts. So basically, every bad decision that could be made was made in Flint. City and government officials denied or dismissed water quality concerns, even after a Virginia Tech study found that over 17% of water samples collected in Flint had lead concentrations above the federal drinking water standard. Now, this is where Dr. Mona comes in. She's pictured there at the bottom. We like Dr. Mona. She was speaking with a friend who was a drinking water expert, and the drinking water expert said that if they are not adding adequate corrosion control, then lead was a huge concern in the water. So she went back and reviewed her patient files and discovered that the blood lead levels in the children patients that she had doubled or tripled since 2014. So Dr. Mona then played a major role in advocating for the public's health, notifying regulatory agencies, notifying the media. Governor Snyder acknowledged that there was a lead problem and pledged to take action. So since July in 2016, the water system has tested below the federal action level. And in 2018, the state of Michigan adopted one of the strictest lead and copper rules in the nation. And it required all utilities in the state to notify customers if they have a lead service line and replace all lead service lines over the next 20 years. So this is a really great example of a medical professional turning into a public health hero and really advocating for her community. Now, lead is regulated under the Safe Drinking Water Act. However, private wells are not covered by the Safe Drinking Water Act, and so there's no requirement for testing. Numerous studies have found that children in homes supplied by private wells have an increased risk of elevated blood lead levels, and a study done by the University of Iowa found that 10% of wells tested in any given year in Iowa have lead concentrations above the US EPA action level, which is 15 parts per billion. Private wells are also a concern for other contaminants. So about 10% of Iowans rely on private wells, and these numbers are based on wells that are reported and that have been tested. So some of these numbers might actually be lower because they're underreported. And according to the Iowa Department of Public Health's well tracking program, 10 to 30% of wells tested in any given year were positive for some kind of contaminant. The Iowa DNR recommends this testing schedule that I have up on the screen, but I would also add lead testing to this, especially in homes with young children. A lot of homes that are on private wells are also older, so some of the plumbing components in the home might contain lead. Iowa is part part of the private well grant program and offers free well testing services. So there won't be financial barriers to people in need of testing if that's a concern. So if you have patients relying on wells, I'm going to say this numerous times in this presentation, I would strongly urge you to talk with them about the importance of well testing. So now we're going to look at a case study. So this is a case out of Maryland, and there was a 91-year-old male who presented with recurrent episodes of acute onset chills, rigors, and hypotension, and they had occurred intermittently for 2 years. The patient presented to the emergency department on 10 separate occasions in that 2-year period. No history of trauma, surgical procedures, travel, or medication changes. Empirically started on antibiotics and acetaminophen on each occasion, and each time symptoms improved rapidly, and the patient felt well between episodes. Now on the right, there's the labs at admission, and they look pretty normal, nothing too remarkable, and all of the cultures were negative. So they went back and pulled the patient history, and when you look at the patient history, you can see that they had positive blood cultures for Ehrlichiosis, which is pretty odd. That's kind of like, where is this Ehrlichiosis coming from? And especially to have it in a positive blood culture. So they consulted with infectious disease, and they ran all kinds of imaging, but they could not find any signs of infection or disease. During questioning with infectious disease, the patient said that they had a personal well, which he used for drinking, cooking, and soaking his dentures, and his wife was predominantly using bottled water. So they sent out a microbiologist who tested water samples from several taps in the home. The primary bathroom sink was positive for Ehrlichiosis, and every other tap in the home was positive for Ehrlichiosis, Klebsiella, and enterogram-negative bacteria, or a mixture of all of them. So the patient was advised to add water treatment to the well. So that was like UV filters and chlorination, things like that, and to use bottled water until the well water treatment was successfully running. After that, there was no more episodes or Ehrlichiosis positive cultures since this intervention. And we don't have time to go into other clinical cases, but I did also want to say that some contaminated private wells have also been implicated as the cause of surgical site infections. So if you have any patients that are having surgeries and will be bathing or showering using a private well, they perhaps want to get that well tested before they use that water for those purposes. All right, now we're going to talk a little bit about nitrate. And just like our source waters, private wells are very susceptible to nitrate contamination. So they can be a source of high nitrate exposure. Potential health effects from nitrate exposure are going to depend on a lot of factors. So it's going to depend on how much nitrate you're exposed to, how long you're exposed, age, pre-existing health conditions. High nitrate levels are primarily a health concern for very young, so bottle-fed infants less than 6 months of age, because they cannot properly digest nitrates and they usually consume a lot more liquid in their diet compared to their size. Babies exposed to high nitrate levels can develop methemoglobinemia, also known as blue baby syndrome. The drinking water standard of 10 milligrams per liter was established to prevent this in babies. If you see a baby with methemoglobinemia, the presenting symptoms will be bluish skin, especially around the eyes or mouth, which you can see in the photo up on my screen, shortness of breath, low blood pressure, vomiting, increased heart rate, and lethargy. Cases of blue baby syndrome caused by contaminated water are relatively rare. However, every once in a while they do pop up, and usually it's a contaminated private well being used for bottle preparation that is exposing them to these nitrates. There is also some evidence that high nitrates can increase the risk of neural tube defects in very early pregnancy. So it is recommended that any pregnant people, so if you have pregnant patients that are using a private well, that well is tested for nitrate specifically. And if high levels of nitrate are found, they are going to want to use an alternative water source or as some sort of in-home water treatment system, such as reverse osmosis. And I know there's a lot of interest in PFAS, so we're going to get into this a little bit. So PFAS is a broad term for a diverse group of thousands of man-made chemicals. So they don't degrade easily, and that's where the term forever chemicals came from. Some of the most well-known examples are PFOA, PFOS, and Gen X. Now, the exact list of PFAS is very extensive, and the EPA maintains a comprehensive, continuously updating list. And as you can see from this graphic, these chemicals are widespread and they're found in many different products. They're in cleaning products, cookware, food packaging, cosmetics, firefighting foam. Humans can be exposed to PFAS directly from using these products or from contaminated food, air, or water. Now, the US EPA states that about 80% of exposure to PFAS comes primarily from consumer consumer products. So the other 20% is going to come from water, air, soil, things like that. These chemicals can also bioaccumulate, so they can build up in living organisms over time. So it's important to note that there are thousands of variations in PFAS chemicals, and it can make them really hard to study because of that. So sometimes PFAS are examined as a whole class, and other times they're examined as individual compounds. But the research conducted to date does reveal some possible links between human exposures to certain PFAS and some adverse health outcomes, as you can see in my chart that I have up there. And health effects are again going to depend on a lot of factors. So it's going to depend on exposure factors. So how much were you exposed to? How frequently were you exposed to it? What is the route of exposure? Duration? Some individual factors obviously always affect everything. So how old is the person? Do they have any pre-existing health conditions? And research on all of these health effects is still ongoing. The pathophysiology for each of these health effects has not been confirmed. So we don't know the exact mechanisms of how these chemicals are affecting parts of the body. But this is what we have as of right now. So what are we doing in drinking water? So the US EPA has established legally enforceable levels for 6 different PFAS in drinking water. So you can see them in my charts there on the screen. Public water systems have 3 years to begin monitoring for these PFAS. So by 2027, to be followed by ongoing compliance monitoring. And I know a lot of drinking water utilities have already started that, including us at Waterworks. And we do have that information on our website. I also included Ames Waterworks also has been doing testing, and their results are up there as well. So if you want to see if your drinking water utility has started testing, you can always contact them and see what they found. Public water systems have 5 years by 2029 to implement solutions or treatment to reduce PFAS if needed. So in this testing, if they do find levels over the trigger levels or the health advisories, then water treatment utilities would have to implement some kind of treatment to get rid of them. And if they exceed the levels, we will have to issue public notices. Now, I put an asterisk on this because there has been a lot of shakeups at the US EPA with this new administration. And so some changes might be coming. And I know it was suggested that they might extend the deadline from 2029 to 2031 to implement those treatment strategies. But that has not been finalized. It's not official. So this is what drinking water utilities have to do as of right now, but there might be some changes. So I just wanted to put that in there for your reference. So now we're going to talk about another group of organisms called cyanobacteria. They're also known as blue-green algae or harmful algal blooms or HABs, and they will form in warm water with high levels of nutrients such as nitrogen or phosphorus. Many factors contribute to HABs, which can be nutrient loading, light availability, water temperature, pH changes, all kind of things will determine if a bloom is going to form or not. Now, blooms can form what we call cyanotoxins, and the toxins they produce can affect most major organ systems and have body-wide effects, which you can see on this slide. And the severity of symptoms is going to depend, again, on how much toxin you were exposed to, exposure time, route of exposure, and any pre-existing health conditions. In healthy humans, depending on how you're exposed and how much you're exposed to, symptoms are generally self-limiting and will go away within 72 hours. While supportive care treatment is generally sufficient, oral exposure may require more intensive care in severe cases. And some individuals can also develop allergic reactions to cyanotoxins and the algae themselves. And these can range from really mild, like skin rashes, hives, itchy eyes, all the way to systemic anaphylaxis. So this photo up in this left corner is actually a allergic reaction to cyanotoxin exposure. That was a person who was recreating in water with a bloom, and they developed that pretty nasty skin rash as a result. So you can be exposed to toxins in a number of ways. So ingestion, that's the one we're worried about in drinking water utilities, but you can consume contaminated food, water, or supplements. So in 2014, Toledo, Ohio actually had microcystin reach their finished drinking water. That picture that you see right there is a sample of water taken from their intake right on Lake Erie. So that's the water that was going into their plant. The bloom was so bad that it overwhelmed their treatment plant and allowed the toxin to break through. And I'm going to discuss what happened in Toledo a little bit more on the next slide. But you can also be exposed through inhalation. So if the water is aerosolized and you breathe it in, you can get toxin exposure that way. We usually see that with recreational activities. Dermal contact. So if it touches the skin, it can permeate the skin and you can be exposed that way. Again, we usually see that with recreational activities, especially swimming, and certain medical treatments. So this was seen in the 90s in Brazil. There was a hemodialysis clinic that was using water from a reservoir that had a bloom, and the water treatment that they had on site at the hemodialysis clinic was not sufficient to remove the microcystin toxin from this bloom. So essentially what they did was directly inject that toxin into the bloodstreams of every patient who were receiving hemodialysis at this time. And as you can imagine, it did not end well. So all of the patients who received treatment during the time period they were using this water did end up passing away. That microcystin exposure was determined to be their cause of death, and many of them did die from acute liver failure. So microcystin does attack the liver, and that's the organ that, for whatever reason, likes to pick up that toxin. And obviously, it can have very damaging effects for people. So let's talk about Toledo. So the Ohio governor during that outbreak had to issue a do not drink order in response to that elevated microcystin. So it lasted for a few days. They couldn't drink with it, cook with it, boil it, touch it, nothing, because of all of those routes of exposure that I previously mentioned. The Ohio Department of Health conducted a community assessment for public health emergency response, and over 50% of households still drank the water despite the media alerts. 16% of households reported symptoms. So symptoms ranged from nausea, diarrhea, stomach pain, vomiting, headache, skin and eye irritation, respiratory illness, to people actually seeing some of that liver damage that I talked about in Brazil. So there was an increase in ER visits across the region, and medical facilities had to execute emergency response plans. So they had to do offsite sterilization of medical equipment. They had to cancel certain elective procedures and surgeries, non-water-based food menus, and they had to use emergency supplies of water that was stored on site or coordinate water delivery. So they couldn't use any water for anything that they were doing. So I do recommend that when you're discussing your emergency response plans, it might be helpful to speak with your drinking water utility and figure out what you would do or how they would communicate to you if they had toxins or any other contaminant, just so you are prepared in case that were ever to happen. So the U.S. Environmental Protection Agency has developed health advisories to provide information on contaminants that can cause human health effects and are known or anticipated to occur in drinking water. So these health advisories are not enforceable. They're just technical guidance for public water supply systems and public health officials when contamination situations arise. So at Des Moines Water Works, we do testing for cyanotoxins and we do target these levels. We want our finished drinking water to be under those levels. Now, because they're not enforceable, not every utility is going to be testing for these toxins. So you're going to want to reach out to whoever your drinking water utility is and see if they're doing that testing and what they found, depending on what their source water is too. So if they're not using surface water, then the chances of having toxins in their source water are lower, but you would want to reach out to them directly and see what they're doing for more information on that. There are also state standards set by the US EPA and Iowa DNR for recreational waters. So I have those up on my screen. They are, so if a water body exceeds the standard for microcystin or bacteria, so specifically E. coli, they'll usually put some kind of signage up that says like swimming's not recommended or something like that. However, despite these warnings, people will still recreate. You'll see them walking right past those signs in their bathing suits to get in the water. So just be aware that some of your patients might be recreating in water that the water quality is very poor in. So if you want to know where you can find more information about recreational water in your area, you can usually find information on whatever county or city is overseeing those freshwater beaches. They'll put it on their websites or social media. So there's an example from West Des Moines here. They post their results as soon as they get them, basically. The Iowa DNR does a lot of beach monitoring throughout the state, and you can call that hotline or go on their website to find more water quality information as well. So now we're going to look at a case. This was a case caused by recreational exposure in the Maumee River, which is fed by Lake Erie near Toledo. So this occurred during that Toledo outbreak that I talked about. So there was a 16-year-old female that presented with genital lesions, headache, generalized macular rash, and a fever. No significant past medical history. There was menstruation with history of tampon use while swimming. The initial treatment was fluconazole for yeast infection, and that was an outpatient. However, her rash and fever persisted with worsening symptoms, and she was hospitalized. So, of course, the admitting physician with her symptoms and the way she was presenting and the history of tampon use initially thought, oh, we have a case of toxic shock. So they started treating her empirically with antibiotics for staphylococcus infection. And then we got some lab results back. So as you can see, the CBC looks fairly normal, got some low platelets there, but the AST and ALT, so those liver enzymes, extremely elevated, and her bacterial cultures came back no growth. So they did not see any staphylococcus infection. So they said, okay, what's going on here? They discontinued the antibiotics when the culture results came back negative, and the patient's condition improved without antibiotics. So they started questioning the patient, and the patient reported swimming in the Maumee River 2 weeks prior. She did not ingest the water, and symptoms began 1 week after this exposure. So that's a satellite image of the Maumee River mouth. So the right there at Lake Erie that feeds into the river she was recreating in, and all of that kind of looks like a thunderstorm, all of that red and green stuff. That's what a bloom looks like on a satellite image. So that was what was there when she was swimming. So due to the clinical findings, the history of exposure, and the fact that there was a bloom that was that bad when she was recreating there, the patient was presumed to have toxic effects from a HAB exposure. So this is a reference provided by the CDC for physicians. And the major takeaway for medical professionals is that medical care is generally supportive and there aren't currently diagnostic tests available. So you can't just like test a patient for cyanotoxins. So much like our case, medical professionals would have to use labs. So like those, that ALT, that AST, kidney functioning panels, things like that to rule out other causes and then sort of talk to your patient about their exposure history if you think that that is something that might be going on with them. All right, so now I want to talk about this next organism. It gets really sensationalized, and I feel like every other tour, every third tour that I do, someone asks about it, so I wanted to bring it up here. So this is the brain-eating amoeba Naegleria fowleri. And cases of primary amoebic meningoencephalitis, also known as PAM, and what I'm going to be referring to it as for the rest of this presentation, are pretty rare in the US, and there's only been about 157 cases over 60 years. And typically we see more cases in the southern states, which have warmer waters and warmer weather. However, as you can see from this graphic, there have been cases as far north as Minnesota and even some here in Iowa. So now we're going to look at one of these cases. And this is a 13-year-old male presented with severe headache, fever, and vomiting, and had a past history of headaches. He had recently gone on a camping trip to northern Florida that included swimming. And so basically what they treated him with was symptom management, so for pain and vomiting, and then some benzylpenicillin for tonsil stones. All right. So then the labs came back. And the white blood cell count looked pretty normal. The C-reactive protein was a little elevated, but there was a cerebral spinal fluid that was really remarkable and alarming. So it was turbid, the protein was very elevated, and the leukocyte count was extremely elevated as well. The patient was given acyclovir, vancomycin, and ceftriaxone because they suspected meningitis initially, and they transferred the patient to the PICU. However, the patient continued showing signs of increased intracranial pressure, so they put some drains in, and a right Giemsa substrate was done on the CSF from the drain, and you can see those amoebic trophozoites that were found. The CDC confirmed the Naegleria fowleri infection via real-time PCR on that spinal fluid. They started a really aggressive treatment. However, unfortunately, like in most cases of PAM, the patient succumbed to this infection and did not recover. So here in Iowa, we have had a couple of cases. So July 2022, there was a Missouri resident that was infected after swimming in the Lake of Three Fires, and that individual did end up succumbing to the infection as well. And then a month later, in August, an 8-year-old boy was infected while swimming in the Elkhorn River near Omaha, and that individual also succumbed to the infection, unfortunately. The CDC does not recommend routine monitoring for Naegleria fowleri in natural water bodies because there's no established relationship between detection or concentration of Naegleria fowleri and risk of infection. So the recommendation basically is if you're recreating in fresh water, keep your head out of the water, plug your nose when going underwater, or wear nose clips, and avoid digging or stirring up sediment. That brain-eating amoeba, if you ingest it, will not cause an issue. It will has to swim up the nose and it will follow that olfactory nerve. So that's why they recommend those nose clips and snorkeling goggles. So do you need to worry about it in drinking water? The short answer is no. So free chlorine or chloramine residual at 0.5 milligrams per liter or higher will control that amoeba. Ingesting it, as I mentioned, will not cause PAM because it has to go up the nose in order to cause that. And typically in healthy individuals, it cannot survive normal levels of stomach acid. Now, the only time this might be an issue is if you have patients that are using neti pots at home or nasal irrigation, and some individuals also do this for religious reasons. And the recommendation from Mayo Clinic, the CDC, and the FDA is if you want to do that, to use distilled water or boiled tap water. You boil the tap water for 3 to 5 minutes and cool until lukewarm, and they have to use it within 24 hours. So that is to prevent this infection. So I just wanted to throw that out there. So in summary, drinking water is heavily regulated to ensure quality and safety. They're doing process support tests daily on treatment. There's online analyzers for a lot of analytes. There's compliance testing that has to be done daily, monthly, annually, and quarterly. Private well owners should absolutely test their wells according to those recommendations. Individuals should adhere to guidance on recreating in freshwater sources. Medical professionals should understand water quality issues and how they can impact public health, and medical professionals play a part in helping educate patients and the community in areas beyond the clinical setting. All right, I know that was a lot that I threw at you, but do you have any questions?
Thank you for that presentation. I'm Jeremy Granger.
Hi, yeah.
Hi, I'm in Sioux City. Um, yeah, just question on as far as like the outlook for the possibility for recurrence of just dealing with the nitrate issue that you guys had this recently in Des Moines. Like, is this something that I guess obviously you plan for because you have the ability to process it, but was there a recent change in either farming practices or something that led to this, and do we expect it to happen again?
Amy, do you want to answer this one?
I'd be happy to.
All right.
Good morning. I think no, I can't say that. Good afternoon. Amy Kahler. I'm the fairly new CEO of Des Moines Waterworks, and thanks for including me on this. We do struggle with nitrates. We have for many years. We constructed at the time the world's largest nitrate removal facility in 1992. So if that gives you any context for how long we've been battling that. Some years it doesn't run at all, and other years it runs a lot. And this year was a particularly challenging year, primarily because of all the rain we got. We find that nitrates concentrations in the source water are much worse when there is a lot of precipitation. And the converse is also true when there is a drought. There is really nothing to flush those tile lines that Katie was talking about in one of her first slides. And so that those nutrients stay captured in the soil and they don't find their way to a waterway. So it is something that we watch very carefully. It's just a part of life when we construct new treatment. We either treat for it, we ensure that we have a water resource or a source that is low nitrate or can be low nitrate, like a lake or a reservoir. Those are typically low nitrate because it allows the nitrogen to be released as gases. And so I think it will happen again, to answer your last question. If the conditions are just right. And this year was challenging because all three of our water sources were above that safe drinking water standard all at the same time for a very long time.
Thank you. I have just two follow-up questions, but I can pause if Dr. Fishman-Gordon has questions.
No, go ahead, Dr. Ranger.
Also, are you guys unique in your ability to handle nitrate? Do other water treatment facilities in the state, is it common to the other ones in Iowa?
There are 40 water utilities that we're aware of throughout Iowa that have to deal with nitrates. and because they use surface water. So it's primarily utilities that use rivers and streams, frankly, that are having to deal with this. We are not the only one, but we are probably one of the most impacted, and primarily that's because we serve 20% of the state. And we are using the Des Moines and the Raccoon Rivers, which have, as Katie showed on some of her slides, some of the most agricultural and most tiled land in the state. And so those are impacting our watersheds and therefore our rivers and streams. We have the ion exchange removal that I mentioned that we constructed in 1992. Other facilities might use reverse osmosis to remove that nitrate. We do have a reverse osmosis plant, but two of our plants, we really have to either blend the water with lower nitrate sources or run the nitrate removal facility.
And then thank you for that. Another question with carbon capture pipelines, we'll see what happens with eminent domain. And if we get more of those, are there potential consequences for water if one of those were to leak I really don't know. I'm relatively new to Iowa, how extensive those are in Iowa right now, but it looks like there's always plans to build more. And if we were to have a leak of carbon capture, are there unique consequences for our water related to any spills of those carbon capture pipelines that you're aware of or no?
I don't know that I can give you a good and complete answer on that. Katie, do you have any experience with that question?
I don't. I would say generally, just sort of for any contaminant, anything that is able to permeate the soil and has any kind of water solubility would be able to enter the source waters and be something that drinking water utilities would have to deal with. I can't tell you specifically about like carbon capture pipelines and what that would look like for drinking water at this time, but it would probably be something that we'd have to deal with. And some of our treatment can already remove like pesticides and things like that. So it probably fall into that category. So some treatment might already be prepared to remove that contaminant, but I can't tell you specifically right now.
Okay. Yeah, like a quick Google search was just saying that carbonic acid could be produced, which can leach like arsenic and uranium. So I didn't know if that was something that's come up because of politically them trying to build more pipelines. And then the very last question I have, we have a lot of lead exposure here in Sioux City, just older area. And, recently, because of that federal law, they did release like addresses and if you have lead pipes, and that has been very helpful. But I frequently get questions from parents in terms of where to go for testing of their of lead content of their water. And I've found that challenging to find labs or easily accessible ways to do that. I usually direct them to our health department, but do you guys know of uh, easy ways to get that done and then kind of general cost?
Katie, you want to take that? Our lab does test for lead. And, if it's a home in our Des Moines area that meets the criteria of 1940s or prior, which is when we typically see those lead lines in existence, we will do that testing for free for Des Moines Waterworks customers. I'm thinking the tests, if they are sent here, are what, $18?
Yep, it's $18 for a metals test. Yep. So it's fairly inexpensive, enough to cover like the cost of our consumables to run the test. I would say there are some like larger labs in the state, like State Hygienic Laboratory, that does mail out sampling kits, so you could contact them, or the drinking water utility in your area. They might have a lab that they send samples to for testing, and you could contact them and say, hey, where do you do your lead testing? Is that in-house or is that get sent somewhere else? And could customers in the area send samples there to get results?
Well, thank you so much. I found this fascinating. I'm from New Mexico and
Okay, yeah,
relatively new to Iowa. We have different
Iowa.
problems out there with fracking and
oh,
whatnot.
sure, yeah.
So, but this has been of interest to me. So I appreciate you guys taking the time to talk to us about it.
Yeah, I'm glad you could come listen.
Yeah, my wife's a pediatrician. She's behind me, so I've been telling her things about the talk the whole time. I'll share it with her afterwards too.
I will just say before we end that Des Moines Waterworks is really well served by experts like Katie in our lab. And, if you need anything, please reach out to Des Moines Waterworks. We're happy to help, happy to answer questions. they're great for us. They help us serve the community in a really positive way. So